Thank you for joining TogetherWell's supplementary video to Platform 2, using teletherapy with questions answered by Dr. Michi Fu. Dr. Michi Fu is a Taiwanese-American first-generation college student that goes by she, her, hers. Dr. Fu is a professor at Alliant International University, lecturer at California State Polytechnic University, Pomona and visiting professor of National Taiwan University. She is licensed as a psychologist in California and Hawaii. She has clinical experience and or research interests related to cross-cultural mental health, international psychology, gender and sexuality, Asian American issues, telemental health, and trauma therapy. She is co-editor of the Handbook of Asian American Psychology, 2nd edition, and co-editor of the Asian American Psychology Textbook, 2nd edition in progress. She is trilingual to conduct therapy in English, Mandarin, and Taiwanese. Her aspiration is to found a wellness center incorporating mental health awareness with other collaborative practices. Example, drama therapy, music therapy, body work, community gardening, meditation practices. As part of her self-care, she is also a social justice performing artist who explores themes through mixed media. This concludes TogetherWell's supplementary video to Platform 2, using teletherapy with questions answered by Dr. Michi Fu. Please join us at togetherwell.org.
Hi everyone, my name is Dr. Michi Fu, and this is my presentation for Take Flight Together, a virtual mental health event. I'm sorry I can't be there with you all even virtually synchronously. I'm actually going to be honoring some students during an award ceremony. We're doing our own virtual event during that time, so I'm sorry that I won't be able to get to sit in and listen to like clinician self-care by my colleague Helen Su, or hear what Jorge Wong and our other colleague has to say about teletherapy and the law, and then our host Michele Haley. Thank you so much for having me and everyone else, and I'm bummed that I don't get to hear your presentation about the different platforms. I love the mission statement about TogetherWell, so thank you for having me. A little bit about my background is that I'm a first-generation Taiwanese American college student, and I go by she, her, and hers. I'm a professor at Alliant International University, a lecturer at Cal Poly Pomona, and a visiting professor at National Taiwan University. I'm also licensed in the states of California and Hawaii, and I've been using telehealth to augment my practice since 2015, and have moved my practice practically to telehealth since going on sabbatical about a year and a half or so ago. So I also have some clinical experience and or research interest related to cross-cultural mental health, international psychology, gender and sexuality studies, Asian American issues, and trauma therapy. My postdoctoral fellowship hours were collected with sexual assault survivors. So my specialty is not just trauma, but intergenerational transmission of trauma. I'm also a co-editor of the Handbook of Asian American Psychology and a co-editor of the upcoming edition of the Asian American Psychology textbook. I'm trilingual to conduct therapy in English, Taiwanese, and Mandarin Chinese, which is why usually people will seek me out for teletherapy. My aspiration is to found a wellness center incorporating mental health awareness with other collaborative practices such as drama therapy, music therapy, body work, community gardening, meditation practices, etc., etc. As part of my self-care, I also am a social justice performing artist who explores themes through mixed media. So as an example, I'm very active in the improv world. Okay, So, thank you, Michelle, for having me. I know I was given a few questions to respond to, so here goes my best attempt at trying to interact with you all and share my thoughts. Okay, number one, how is telemental health rewarding? Well, the bottom line is it's very efficient. You can connect from anywhere as long as you have secure Wi-Fi and a safe environment. So if you can guarantee those kind of conditions, which isn't always possible for people, then you could make a connection. And although it's different than in-person therapy, which we'll get into later, it's quick, and so you don't have to get into a car, you don't have to get on an airplane. So there's many different types of perks to it. Another related part of this question, what are the benefits of using this modality with clients in comparison to in-person work? So this is an excellent question. Well, number one, it saves time on both sides for commuting. And commuting could be a car ride for some that are privileged enough to have their own transportation. For some people, it could be a public transport ride or a ride share arrangement or whatever. You know, some people have transportation barriers. So it saves time and energy on commuting. It also saves money on transportation, the actual wear and tear of your transport or taking public transport and whatnot. And overall, like gas and energy on the environment kind of stuff. So a lot of things that are probably more difficult to quantify. So there are those kind of benefits. Are there situations when telehealth is contraindicated, I wonder, asked Michele Haley. Absolutely. So I am supervising some students, and one of them is at a VA setting and is doing exposure therapy with a veteran. And so part of their therapy is doing exposure therapy. And so at a certain point you can do in vivo, and so you can kind of imagine some of the anxiety-provoking stimuli. But at a certain point, if you can't expose your client to it, then there are some limitations. So it, makes it more challenging. You have to adapt it. It's also contraindicated for very high-risk patients. So if someone actually needs a very high level of care and you accept them into your practice saying this is sufficient point of contact, when in fact they actually need maybe inpatient or something, then of course that could be contraindicated. Okay. Another question that Michele Haley had posed. Any special things to be aware when doing telehealth with high-risk clients, safety planning, etc.? So what I typically do when I'm doing any kind of engagement with a potential new referral is I send them screening questions. And in the screening questions, one of the things that I'll ask for is kind of a risk assessment. I'll ask if someone's actively suicidal, homicidal, etc. And I state very clearly what the limits of my accessibility are in terms of not only am I an outpatient, I'm not an inpatient service, nor am I equipped to handle crisis where I'm expected to return a phone call within a certain period of time, nor am I typically accessible in person, where default is I'm typically available on a perhaps weekly basis, but only through telehealth as a default. And although it's not unusual for us to have the opportunity to meet face-to-face, that wouldn't be the default. So I very clearly outline the limits of my accessibility. So I screen through the screening questions, and then even after that, I send a huge packet of intake documents. And within the intake documents are informed consent about the limits to confidentiality, my accessibility, etc., etc. And then if after receiving those, it seems like could be a good match. Then during our intake session, I then again go over limits of confidentiality and any kind of more sensitive matters like danger and threat to self or others. And then every so often, because maybe during intake they weren't feeling particularly at risk to themselves or anyone else, but maybe over the course of our work together, we need to reassess. And so I do subsequent safety plans to assess for different level of care needs, and then we figure out if this is indeed going to meet that person's needs. And so I'm able to also serve as case management and refer them to a different level of care if needed. So as an example, like some of my patients will transition to a different setting, like going into a university setting. So then we talk about the resources that are available to them there. Okay, number 4, what challenges are unique to telemental health? The ones that I've noticed are you have to be aware of what your technology limitations are. And so this could mean that if I have an earlier generation laptop where it meets my needs for word processing, maybe the camera on it or the lighting attached to the hardware is not optimal for delivering a message, or even for me to communicate in real time with my patients. So there's hardware kind of considerations that you want to be thinking about in terms of technology limitations. I also think about whether it's realistic to you and your patients have a secure space without interruptions. So right now with COVID-19 shelter in place, this is most likely going to be your home, but is there space within the home where you're not going to have people running around in the background, and by you, it's also your patients. So some of them end up saying that they don't mind, but I do talk about the importance of, like, you have to be able to break down and cry. So think about where it makes sense. Some of my patients end up deciding in their closets is where they have some privacy. Some decide like in their cars, within the garage. So we think about their emotional safety and their physical safety as well. And then also having reliable Wi-Fi. So depending on what kind of service people have and what setting they're in. So I know there are some providers that have cable in certain regions, and then fiber or something, that I don't know the terminology, but I recognize that depending on where a person resides, that could determine what kind of vendor they have to go with. So that's something to consider. Okay, how does a clinician go about addressing them is another question. When I do, in my screening questions, I talk about what kind of technology people will need to consider having in order to see me through telehealth. When I give the intake documents, in there is a telehealth consent. And I then again talk about what they'll need to consider in order to make it feasible to have a telehealth session. And then during pre-intake session recommendations, I'll send them a detailed correspondence letting them know how to test out their equipment in advance. I think everything short of screenshots. And then as needed, I will troubleshoot in the moment. So what ends up happening is I've also become inadvertently kind of like a unofficial IT troubleshooting, just because I've gone through it maybe a few times with some other folks. So I kind of know, if you hear an echo, it's because of the person on this end with a higher output on their speaker or something. So certain things like that, I know how to troubleshoot now. Okay, number 5. In your experience, do clients take advantage of the increased access granted to them when you share your personal contact information? How do you address this? So as mentioned before, I try and assess for safety and set limits as appropriate. I do have some patients that when they have my email address, they'll send me 4 long emails in a row and then say as part of couples therapy, please don't say this. So I use that as clinical information, and I remind them of how the couple is my patient and how these sidebar conversations will be brought back to the couple as the patient. So I really try and set limits as appropriate. I also remind my folks that I'm only equipped as a one-person staffed weekly resource, typically. Maybe on a crisis basis. Occasionally I can be available for a little bit more than that. But then I refer them not just to 911 if there's a crisis, but to other resources out there to augment the work that we do. Okay, number 6, for example, how do you manage boundaries if your client can text you all the time? So I actually let my patients know that they shouldn't expect a response from me within a certain amount of time because I'm not equipped to do that. And when they do it the first time, I will respond and let them know this is what happens when you contact me. But if they continue to contact me when there's no crisis, then I point that out and I say something along the lines of, what my outpatient abilities are and what their expectations might be and how they might be actually looking for a different level of service than what I'm capable of. So we talk about expectations and what's realistic. Okay. And then I also talk about, in addition to how I'm a once per week session resource, that maybe I require 24 hours to respond to non-crises type of messages, etc., etc. Okay, the next question is, what advice would you give to a first-time online therapist? Okay, here's where I would say hardware actually matters. I tested out with someone on different platforms in terms of like using different software. And then I also used my different hardwares, and we realized like, wow, what a big difference between even a laptop that I consider to be my backup laptop, a laptop that is very nimble, my iPad device, and my phone, the different qualities of images and sounds and things of that sort. So be very familiar with what your hardware is capable of. Also, Wi-Fi really matters. So if you're going to be working from home, especially if you're going to be giving interviews to the media, you want to make sure that you can come across clearly as real time as possible. There's nothing worse than appearing like you don't understand when in fact you just didn't hear. So Wi-Fi capabilities matter. And then also I was grateful to take a free 2-hour continuing education workshop from American Psychological Association by my colleague Marlene Mayhew, who talked about the importance of telepresence. And so basically having an awareness of how you're coming across, like, are you aware of whether or not you combed your hair, and how engaging can you be? So being aware of bringing your best self regardless of the platform. Okay, next question. Speaking to the interplay of COVID and telemental health, many clinicians are using this for the first time due to COVID. What are some challenges to providing telemental health with respect to rapport building and clinician self-efficacy? I think the most important thing is to act human. So if you treat the hardware like a barrier, then it will be more difficult to connect. But if you view it as just a way to facilitate with someone that you're trying to communicate with, then it makes it a lot easier to get that message across on the other side. I also try and be genuine about my technology knowledge as well as my limitations. So I'm pretty verbal about what I can and can't do, and I apologize up front And then I am also grateful for what technology is enabling me to do. And above all, I try and engage in communication skills that appear like active listening skills. So I try and engage anyway. So hopefully that's something that for first-timers with Telemental Health will do, is use this as a resource rather than as a barrier. Okay, what are strategies for facing those challenges? So I still think it's possible to convey empathy and genuineness. I call out my patients and I'll tell them, hey, you just made a face just now. You want to say something about that? Or I'll tell them things like, just now you poked your partner in the ribs. What was that about? And then they'll tell me, oh, he was shaking his leg. And so then I'll call them out on things, you know, just as I would if they were in session with me. And Marlene Mayhew, in that training that I took, said a couple things. One, a replacement or not replacement, a proxy for mental status, where they would typically be in front of you, where you can kind of assess whether or not they've been engaging in good hygiene. But she said, have them show you their fingers, their nails or something. And if they look generally clean versus kind of not well kept, then that's information for you to have. So another thing that Marlene had said is ask for a room scan. And so, you know, tell them, okay, show your device. And that can serve a couple purposes. One, for mental status purposes, like whether or not they're taking care of their living environment kind of stuff, or whether or not it's safe for them to be communicating with you about some sensitive topics. Is there someone else in the room? Okay, and then also just remembering the basics of clinical interviewing skills. So the same things about paraphrasing and somehow, you know, validating people's experiences. Those are things that we do know how to do, and you don't have to be in the same room. You can do that over the phone. You can do that over FaceTime with your family. You can do it through these telehealth platforms with your patients. The same kind of rules apply in terms of using active listening and empathic statements. So just going back to the clinical interviewing skills. Okay, and the last question that Michele Haley had posed was, in the absence of the felt sense of the individual in the room, how do we know we are conducting effective therapy and connecting with clients across the digital divide? I just keep on asking my patients for feedback regularly. So when we meet in person, I'll tell them what to expect, and I actually won't transition until I feel like they're stable enough to transition, and I'll keep reassessing. Like maybe the first session, I'll say, how about we do an intake follow-up in person again? Let me know if you feel ready to go to telehealth, but we don't have to. And so they usually let me know when they're ready to go. And then I'll keep on checking in. Okay, so now we've tried in person, now we've tried telehealth. Are there benefits to us meeting in person? And if so, let's switch back to that. So I do check in regularly. And I also will offer in-person opportunities as appropriate. So for those that have already been to my office before, it's not far-fetched for us to go back to my office. For some that I started telehealth with for some reason or another, maybe due to scheduling or whatnot, then I will offer, when I think it's appropriate for us to meet in person, as long as I feel like it's not contraindicated. For example, like clinical presentation of agoraphobia or something like that. So those are my responses to Michele Haley's questions. I want to thank you very much for letting me participate in this event, and I wish everyone well. I hope everyone's engaging in good self-care during these challenging and opportunistic times. Thank you very much, and take good care.